Hello, it's Dr. Rhonda Johnson, and today is Thursday, March 3rd, 2022. And this message is the final message, part 4 of a series of messages that I am doing to review at a high level President Biden's national COVID-19 preparedness plan. Now, this last message focuses on the last 2 key goals: to prevent economic and educational shutdowns and to continue to lead the efforts to vaccinate the world. Now, to keep the economy and businesses and schools open, the plan says the federal government's going to focus on improving air ventilation and air filtration. They plan to offer education and technical assistance. They plan to provide a clean air and buildings checklist that all buildings can use and provide technical assistance. They plan to ask Congress, if they haven't done already, to approve paid sick leave for workers due to a case of COVID or care for a loved one who has COVID, using tax credits to small and medium-sized businesses to help provide this paid sick leave. And the administration plans to open up all the public-facing federal offices like Social Security offices and bring the workers back in the office. Now, to continue to lead the effort to vaccinate the world, the Biden administration has committed to donating 1.2 billion doses of vaccines to other countries for free with zero strings attached. And as of today, the government says it has delivered over 475 million free doses of COVID vaccines to 112 countries around the world. Now, the government also plans to keep deploying emergency supplies for countries who are experiencing surges in COVID, such as oxygen and personal protective equipment and other supplies. So, folks, that's the overview. To get the full details, please go to www.whitehouse.gov and you can read the full 96-page report. So in summary, I recorded these 4 videos today because I think this is a big step forward for our country and the world. You know, living with this virus does not mean giving in when it comes to COVID. We have to continue to develop new treatments, new therapies, new vaccines, because the virus keeps evolving. You know, epidemiologists say a disease is endemic when its presence becomes steady in a particular region, or at least predictable, as with like seasonal flu or even malaria. But in my opinion, COVID is not yet predictable. The scientific community is still playing catch up, and we don't know what the future holds for these new variants. It's going to take time. Millions of people will continue to get infected. And sadly, this global pandemic is just one of many challenges the world faces right now. As always, my views are my own. Take care, folks.